Hi, everyone. My name is Kelly Chapman. I'm the Senior Program Coordinator here at the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. Welcome. We are so glad to have you for part one in our series on supporting autistic students in the classroom with anxiety. This is the first in a two-part series, so we would love to see you again in a couple weeks on February 21st at the same time for part two, and we will be sharing a link to register for that session as well. We encourage you as you're coming in to introduce yourself in the chat. Let us know your name, your role, where you're joining us from. And if during the presentation you have any technical difficulties or audio issues, please let us know in the chat and someone from our team will address that with you. During the course of our presentation, we will be sharing a link to a brief survey. This survey is required by our funder and allows us to continue to do our work. So we ask that you take a few moments to fill that out. It has two parts, so be on the lookout for both. And at the end, you will receive a certificate of attendance if that's something you need for being at today's session. And if you've taken our surveys in the past, we did want to highlight that SAMHSA has recently changed the survey, making it easier to provide your feedback. So please do that. And then before we get into the session, we do have a quick disclaimer. The views, opinions, and content expressed in today's presentation do not necessarily reflect the views, opinions, and policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We are located in Atlanta, Georgia at Emory University Rollins School of Public Health, and we are proud to serve the 8 states you see here on the map on the slides. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which provides us a unique lens through which we can address the mental health priorities in Region 4. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. And now I am very happy to introduce our presenter for today, Dr. Catherine Picard. Dr. Picard is an assistant professor at Emory University School of Medicine and at the Marcus Autism Center. She received her doctorate in clinical psychology from the University of Michigan and completed a 2-year postdoctoral fellowship with JFK Partners at the University of Colorado School of Medicine. Her primary research interest is in the translation of evidence-based treatments into community systems that are naturally positioned to serve autistic children and children with other developmental disabilities. Clinically, Dr. Picard is a licensed psychologist with a strong background of supporting autistic individuals across the lifespan, and she holds specific expertise in parent-mediated intervention for young children, as well as cognitive behavioral therapy for autistic youth who have co-occurring anxiety. So now I am very happy to turn it over to Dr. Picard.
Thanks so much, Kelly, and thanks everyone for being here. It's awesome to see so many people, and I appreciate you introducing yourself in the chat. I saw people are tuning in from all over. I saw someone in Bermuda, New Jersey, and Utah. So welcome. We're really excited to have you here this afternoon. Before we get into talking through the objectives for the webinar today and some of the goals that we have, we do just want to give a little bit of a note on some of the language choices that we make in this presentation. If you've been to one of our webinars before, you've seen this, but within our products on autism, so this includes both our webinars and some of the infographics that we put out, we use identity first language. And so you'll hear me saying things like autistic youth or autistic students. And we've made this decision for a number of different reasons. The first being in response to the neurodiversity movement, really based on the preference of many autistic adults and in order to avoid the use of ableist language, but we recognize that this is not the preference of every individual or family, and that many people continue to use person-first language. And we have a citation here that's a great reference, and I think we're going to drop in the chat too. There was a great practitioner guide to language use in schools, and so feel free to check that out if you're interested. Okay, so before we get rolling and talking about anxiety, I think it's super important to know that the presentation today builds from lots of different kind of materials and resources and webinars that we've done in the past. And so you can check some of these things out. We have a toolkit for supporting the mental health of autistic students and students with other intellectual and developmental disabilities. And this includes previous webinars that were done on identifying and supporting autistic students with anxiety. And so I think please check this resource out. I think there's some really valuable tools in it related to mental health. With that said, the goal of today is not to be a long didactic presentation on anxiety and autism. It's meant to be structured in an office hour format, if you will, even though it's 90 minutes. We're still going to call it an office hour. And really, the goal of this first office hour is devoted to identifying anxiety in autistic students, right? And so this is going to be focused on you have students or other kids that you work with, what might you be looking for, right? How would you spot anxiety? How would you know it's anxiety? And so our specific goals are to identify anxiety and signs of other mental health challenges in autistic students, to describe some of the risk factors that make autistic students more likely to have mental health challenges, including anxiety. And we'll be spending the bulk of today taking that information and applying it to a couple of case studies. And so we'll be using an interactive feature called Jamboard, where we'll be kind of brainstorming together some of the signs that we're seeing that might cue us into students having anxiety. I think it's super important to know, like Kelly mentioned, that this is part one. In 2 weeks, we'll be diving in and talking about, well, what the heck do you do when you have students who are anxious, right? It's one thing to identify it and to know it and to see it. And as you know, it's a whole other ballgame to then support students in managing anxiety symptoms. And so we'll talk, within our case studies, we might hint at some things, but really 2 weeks from now is where we're going to dive into those strategies in much greater detail. So stay tuned for that. Okay, so before we get started today, we wanted to just do a check-in. I know y'all have introduced yourselves in the chat, super helpful to see, but we're interested to know what your professional role is, and how much of your time you're really spending working with autistic students and students with other mental health challenges. So if you could fill out this poll, I think that'd be super, super helpful for us. Awesome, there you go. Thanks so much for doing that. And Kelly, would you in a few seconds be able to share it out? Awesome. Okay. So again, just to give you a snapshot of who's on the call today, looks like we have a good amount, not surprisingly, of folks in a mental health role, social work, psychology, counseling, and folks in other positions. If you indicated other, I think it would be really nice for you to kind of let us know in the chat. I saw a few school nurses who are introducing themselves, but please let us know what that other role is. And it looks like there's, as we would expect in all of our webinars, there's a huge range in terms of what people are doing and how they're intersecting with autistic kids, with folks who are hardly at all to folks who are spending a majority of their time doing this. Very cool. So behavior specialist, school-based mental health therapist, really, really helpful to see. All right. My mouse gets a little trigger happy, so sometimes, like it is right now, I'm going to try and not touch it. Before we, again, go into our case studies and the more interactive component of today, I think it's really helpful to just give the backdrop for why we care about anxiety in autistic kids and some of the background information on how anxiety might show up in our kids. So as you can imagine, right, mental health challenges are prevalent in all kids, right? But we know that autistic youth are much more likely to experience a broad range of mental health challenges. And so this table here on this slide represents the prevalence of a number of different mental health conditions in autistic youth and the prevalence rates of the same mental health conditions in the general population. I think it's obviously, as you can see, anxiety is particularly striking in our autistic kids and is much more prevalent often than in the general population. One thing to know, though, as you can imagine, is that these stats are pre-COVID stats. And as I was putting together the slides for this presentation, I went and I was searching for, can we really update these slides post-COVID? And I think we know that at least in the general population, right, the prevalence of all mental health conditions, including anxiety, has exponentially increased. I was not able to get updates on autistic kids specifically. So just keep in mind that these slides are pre-COVID, but we really often are seeing that autistic youth are experiencing much more anxiety than the general population. So what is anxiety, right? Anxiety is a subjective sense, right, of fear, distress, worry. We all experience anxiety, right? And in fact, a little bit of anxiety can sometimes keep us safe, right? It prevents us from doing things that are dangerous. But a lot of anxiety can be a big problem, right? And anxiety disorders occur when anxiety symptoms are persistent and they start to get in the way, right? They're interfering. So, all of a sudden we're not able to go to school, right? We're not participating in class. We're not making friends, and in part because of anxiety. And so I think that interference piece is super important for us to be thinking about, and especially thinking about this in schools. Schools are anxiety provoking for lots of kids. And so we really want to be thinking about, well, how is this showing up and how is it making school hard for autistic kids? Anxiety disorders range from things that are very specific, right? We have our phobias, right? Fear of heights, right? Fear of specific insects or bugs, to anxiety disorders that are evoked by a broad spectrum of things. So these are like our generalized anxiety disorders, right? Where worry is pretty pervasive across lots of different situations. And again, right, the thing to be thinking about here is, obviously what evokes the anxiety is super important to know. But again, how it gets in the way and how it shows up is equally, if not more important to know. So why is it that autistic youth experience more mental health challenges? I think this slide here just represents some of the things that may make our autistic students more vulnerable to mental health challenges. This is surely not everything, but some of the things that we know. So we know that there may be some shared biological etiologies or shared overlap between autism and other psychiatric conditions. And some things that we'll be talking about today are the other things on this slide, which is that autistic kids are often more likely to be experiencing discrimination, victimization, and segregation in lots of different settings, right? And those things absolutely contribute to mental health challenges. Some of our autistic kids have co-occurring medical conditions, things like seizure disorders or GI issues that can be anxiety provoking. Sometimes kids have executive function or organizational challenges that just make certain activities hard and harder to process. And then finally, we know that our autistic kids, many of them have sensory differences, and those experiences can feel overwhelming and can make certain sensory heavy environments anxiety provoking to be in. I'm thinking about, for example, the cafeteria assemblies, the school fire drill, right? And so I think it's again important to have that context for why should this be on my radar, and what are some of the things that might be contributing to this in my students and kids. Okay, so backdrop, right? Anxiety is super prevalent, and there are lots of reasons why autistic youth may experience anxiety more than the general population, but it's not the easiest to identify, right? And that's part of the reason we have this webinar, is that there are some things that I think are really important to be thinking about when you're working with autistic kids. So what are some of the challenges? First, problem behaviors, right? So one of the things that we see all the time, right, is that things like aggression, self-injury, other difficult or naughty behaviors, right, like yelling, can be at times seen as naughty behavior rather than mental health challenges, right? So I think a lot about, well, what do kids do when they're anxious? Well, they do all sorts of things, right? And for some kids, being anxious evokes a fight flight response, right? And so we do sometimes see that problem behaviors are actually miscategorized as naughty rather than mental health challenges. Diagnostic overshadowing. So this is when symptoms of anxiety and other mental health challenges are seen as parts of autism. So an example of this might be, for an autistic student who becomes anxious, perhaps they are going to engage in more self-soothing behavior like rocking, right, or stimming. And people see that and they're like, oh, well, that's just autism, right? That's not anxiety. And so we want to be paying close attention to what kids are doing and what their behavior is. Same, very similar concept, diagnostic overlap just means that, right, there may be certain symptoms that are prevalent in both anxiety and autism and can be tricky to tease apart, right? So shutting down and not wanting to talk to people can be, right, a symptom or a trait of autism, right, where kids may be more socially withdrawn, but it's also a symptom of social anxiety. And so it can be hard to figure out, well, are we not, initiating or talking with kids because they're anxious, or is this just because it's in this moment maybe not a preferred thing to do? Psychosocial masking, you might be familiar with the term masking, and masking just refers to students being able to hide their anxiety, right, or their mental health challenges at school due to not wanting to appear different. And I think we have to be really careful about that. There's more and more research to show that kids do mask, right? They want to fit in, and we want to be mindful of that. And then finally, and this relates to some of what we've talked about a little bit already, we see that symptoms, anxiety symptoms specifically, may just look a little different in autistic kids. And so I think I want to circle back to the example I gave earlier, where, in autistic youth, anxiety may also look like an increase in autistic traits, right? So some of those kind of repetitive behaviors. So it might be that kids are becoming anxious, they're rocking more, they're scripting and using kind of scripted language more. And so anxiety symptoms, again, may maybe just look a little different. So just, with that in mind, I think it's important to talk about, okay, well, what the heck does anxiety look like, and what's at the core in autistic kids? And an important thing to know here is that emotion regulation is really at the heart, right, of mental health challenges and anxiety in autistic kids. And we have previously talked about emotion regulation in other webinars, and there actually is an infographic that we've put together on emotion regulation in autistic students, because it really is core to lots of mental health challenges. But emotion regulation is the ability to recognize and manage your reaction to the environment. And so, right, again, difficulties with emotion regulation can be a risk factor and kind of underlying cause for different mental health symptoms, right? Not just anxiety, but thinking about depression and other things. So when we get to talking about, in 2 weeks, we're going to be talking a lot about, well, how do we support autistic students with anxiety? And we're going to talk a lot about emotion regulation, lots of evidence-based intervention programs that support anxiety, not just in autistic youth, but in the general population as well, support emotion regulation skills. And again, we'll talk specifically about what that looks like. The slide here just again demonstrates that we have kind of emotion regulation at the foundation of kind of the pyramid. That emotion regulation can manifest as anxiety, right, as irritability, as depression. And sometimes, right, and the reason this slide has the top component here is to, again, hit home the anxiety can manifest in lots of ways. I think people typically think about, shutting down or being quiet and withdrawn, but anxiety can also look like problem behaviors in schools. All right. So let's dive into anxiety symptoms even more and talk a little bit about what this could look like in the general population. So when we think about anxiety, we think about three kind of core symptom areas, if you will. So the first being our physiological symptoms of anxiety. So these are things like, probably many of us on this call have experienced, right? We get anxious, our heart beats fast, we feel shaky and restless. We may look tense or anxious. We may cry or scream. We may have sleeping or kind of feeding or eating disturbances, right? And so these are kind of our internal experiences of anxiety or physiological symptoms. Many of us also have cognitive symptoms of anxiety, right? And so what does this look like? These are our cognitive distortions, like, oh my gosh, it's the end of the world. Everyone's gonna laugh at me. So things like, negative self-talk, rumination, so getting really stuck on things that make us feel anxious and feeling the need to talk about them, to process them, to think about them. Worry and anticipation of negative events. So really viewing and thinking that things are going to go wrong, right? And predicting that they will and feeling for sure that they will. So behaviorally, what do we all do when we're anxious? When we feel this way and are thinking in this way, we, rightfully so, we avoid things that make us feel anxious because perhaps they are dangerous or going to be scary. We withdraw, right? We seek reassurance, right? We start to talk to people, right? We hear people say things like, oh, I'm about to give a presentation, right? I'm gonna mess it up, right? And sometimes, those comments and questions, right? We say them, right? Because we want someone to then say, well, no, it's fine. You've done this before, right? Or we have kids ask questions like, is it gonna be hard? Is there gonna be a fire drill tomorrow? Right? And those behavioral cues maybe signaling, right, that there is this anticipatory worry, right, about something bad happening. So I like to think about these groupings here just as a way to really break down some of the categories of anxiety symptoms that we might see. All right, so common categories of anxiety, right? So things like animals, we have our specific fears here, animals, bugs, doctors, the dark, crowds, having blood drawn, right? Those are very common fears. For kids, separation from caregivers is a developmentally appropriate worry, right? That we see in very young children, right? But that can persist and become interfering later on. Social fears are very common, being worried about what other people will think about you, being worried about being teased or bullied. And then thinking about some of those chronic worries too. So this is just worry about like academic performance, making mistakes, death, dying, the future, world events, right? Politics, and those are kind of the things that would fall into that category. In autism, right, we see other types of worries too. I will say what we just went over, we see in autistic kids too, right? Though these still apply in the same way. And we see some other things that I think are important to know about. We see, well, for lack of kind of a better word, some kind of idiosyncratic or fears that may be less common in the general population, right? And so fear of very specific things that, may not have a biological, fear of snakes, right? There are biological reasons we have those fears. Some of these other fears, maybe less so. Worry about transitions and change, right? So worry about changes in class schedules, having a substitute teacher, right? And I think it's really important to know here that this is not just, the kiddo is having a difficult time with the transition, right? That they get really upset when it happens, but they're also worried it might happen in the future, right? Is there going to be a substitute teacher? Is my schedule changing? Right? So we're really looking for that anticipation as well. We've already alluded to the fact that situations that cause sensory aversion are really important to know about, right? So fire alarms, assemblies, the cafeteria, places where there might be fluorescent, horrible lighting. Those are things that can be anxiety provoking, right, for kids, right? It's not just that they're aversive, they're actually evoke an anticipatory worry or reaction to needing to go into that situation. Confusion or fear about social situations. And so this is maybe a kiddo's not worried that they're going to be evaluated negatively, but that they're worried about the social situation because they're just hard to navigate and figure out. Um, and then worry about not being able to do things that the kid really, really loves, right? And so it might be that, there's a change in schedule and now we can't actually play on the tablet or do that game that has been the student loves. And so again, this is not just being sad when we can't access things, but it's actually worry about whether or not a kiddo is going to be able to do these things. I wanted to highlight, I think this is important to just like kind of briefly hit on that. A while ago, I was part of a project that was really aiming to understand how does anxiety show up in schools for autistic students, right? I think we can review all these symptoms, right? The physiological symptoms, the behavioral symptoms, but as part of this project, we talked to parents of autistic students and then also to school providers to really understand what they're seeing at school as kind of the main red flags of worry and anxiety. And so some of these are direct quotes from parents, but I think I thought this was important to share. So we have parents say things like, this is a kiddo who flies under the radar. This is a kid who gets stuck in a loop, right? So referring back to that rumination and needing to just process anxious things. Kids, whoops, sorry about that. Kids who are saying threatening things, right? So they get really anxious and they start to say, well, I'm not going to do that. Or if I have to do that, I'm going to run out. Refusing to do things, right? We see that a lot, right? Things make kids anxious and they say, right? I'm not going to school. We even sometimes see elopement. So not just I don't want to do it, but I'm going to run away because it's so hard. And so I think that's important to know. So kids not going to school, kids being clingy, and kids potentially going nonverbal, right? Or going silent. When we ask school providers, same sorts of things, right? I'll just start in the bottom left, right? So instigating peer conflict, having low confidence, attendance or tardy issues. And I think that's something that we see a lot. Hiding under the desk, right? Leaving class. So some of that avoidance and wanting to get out. Perfectionism. So having a really hard time making mistakes and disruptions in class. Something that didn't come up here that I'm not sure why it's not on this slide is we also see, right, when we thinking back to that slide that had the physiological symptoms, the cognitive symptoms, and the behavioral symptoms, right? We often, for lots of kids, right, see that those physiological symptoms can trigger things like trips to the nurse's office. So again, these are kids who are like, I have stomach ache, I have a headache, right? I'm not feeling well. And all of that may very well be true, right? Because anxiety can really not feel great. And so we might see things like that popping up. All right, just looking at our time. And just quickly before we move into our case studies and some of our more kind of hands-on components, I just wanted to again hit that, why should we care about anxiety? Well, anxiety shows up at schools and it can, back to that interference piece, it can really get in the way, right? So again, school refusal that looks like absences and tardies, right? We have autistic, kiddos who are showing more autistic traits, and that might mean they're becoming less engaged and having a harder time forming relationships with peers. We might see things like reduced extracurricular participation due to worry, trips to the nurse's office, and lots of avoidance, right? Lots of avoidance, which can look like shutting down or, non-compliance, right? Kids who are not wanting to do things that make them feel anxious. All right. So before we move into we're going to move here in a second into a case study. And what we're going to be doing for our case studies is we're going to be using a platform that is called Jamboard. And so for those of you who have not used Jamboard before, we're going to do a tutorial in a second. But I think the thing that's important to know about Jamboard is that there is a cap on the number of people who can be in Jamboard at one time. And so we are cognizant of that. It's a super cool platform and we get to see visually, right, like what everyone's thinking and to categorize certain themes. But for those who attempt to get into Jamboard, right, and are having a hard time getting into it or it's already full, we also are going to be monitoring the chat and moving anything that's put into the chat into Jamboard as well. So it's going to show up there. And just wanted to give that caveat in case you're trying to join and you're like, oh my goodness, what's going on? So we're going to move to Jamboard in a second, and we're going to be doing a combination of polling and Jamboard questions related to two case studies. Before we make the transition, I just wanted to hear from y'all. We went through a overview of what autism, or what anxiety can look like in autistic students. And I'm wondering if there are other things or other symptoms, other signs that show up that we didn't talk about. And I would encourage you to put those in the chat. What sorts of things also come to mind for you? Okay, all right, here we go. Nail biting and picking. Yes, that's a fantastic example. Changes in verbal communication, selective mutism, noise making or difficulty speaking, breaking things, reaction to any task or demand placed on the kiddo. Yeah, totally. It's like they've already become anxious and then any additional demand is too much. Self-harm, yeah, scripting, aggression, silliness. Thank you, Janet. Yelling, refusal. These are fantastic. And I think really get at, right, this idea that anxiety can look a lot of different ways. And in our case studies, we're gonna really tease apart, well, like, how do you discern, right? Are they, being silly because they're just silly, right? Or are they being silly because maybe they want to get out of something that's hard or they're feeling anxious? And I think those can be really tricky things to figure out. Again, sometimes easier, and sometimes kids can actually tell us they're anxious, but other times we're trying to piece together information from lots of different sources to make a decision. Yeah. Oh, these are so good. Refusal. Yeah. Upset when, peers are not following the rules. Absolutely. Regression. Yeah. Yes, those physical symptoms are really big. Well, I'm excited to, our juices are flowing and now we're going to move into, we've got two case examples. And we're going to start with the first one here. We're not going to move into Jamboard quite yet because we're going to do a few polling questions related to this case study and then we'll move over. So our first case study, I'm just going to move my chat box so I can see the case here, is that this is a kiddo named Sam, and Sam is in 4th grade. She doesn't have an autism diagnosis, but she participates in the school lunch bunch group and receives some support related to her ADHD and learning disability. And she's enrolled in general education and receives some pull-out support for reading and math. However, over the past academic year, and I think I'm just going to pause while I'm reading this to give the caveat that the reason I'm like, you're probably like, we're talking about autism and you're saying this student doesn't have an autism diagnosis. The reason that this case study is the way it is that we know that a lot of kids with autism may not be identified and are not identified until they're much older, right? Or are flying under the radar, but are getting support with social skills, right? Or kind of peer relationships. And so I'm putting this kiddo as an example to suggest, right, that not all of our kids who are autistic carry those diagnoses, and especially in schools. So over the past academic year, Sam's school team has noticed that she's not raising her hand in class and she's putting her head on her desk when called on, or she looks frozen when she's called on. Her team has also noticed that Sam seems to ask repetitive questions when it comes to upcoming tests and assignments. So she's asking things like, is it going to be hard? When is it due? Her mother shared that Sam is also asking her a lot of questions at home about upcoming assignments and is starting to complain about stomach aches before school. And her school team's wondering if anxiety is at play and what their next step should be to support her. So we'll keep this case study up, but we have some questions just to kind of get everyone's juices flowing, and then we're going to transition into our Jamboard. So question number 1 is, all right, cool. Okay, so within this case study, we're just interested to hear, about how many specific behaviors do you notice that suggest Sam might be feeling anxious? And this, you don't need to go through and necessarily count per se, but like ballpark, how many flags did you hear? What makes you think that Sam is anxious and not just kind of being difficult or, so what are the things that are showing up for you? And you can choose more than one for the second one. And then Kelly, I'll have you share it back. And there is in the poll, there is the option for other. We recognize that there are potentially other things that are at play that we don't have there. So please let us know what else you notice. All right. Oh, this is so fun. Okay, so how many specific behaviors do you notice? Most people are saying in the range of kind of 3 to 7, which I think is seems reasonable, right? And so now we asked you, what exactly did you notice? So it seems like the most prevalent signs, right, are complaining about stomach aches, looking frozen, asking repetitive questions. But yeah, that putting her head on the desk when she's called on, not raising her hand, we may want to do a little bit of digging, right, to figure out what's going on there. But those certainly could be signs of anxiety, depending on what we learn. Yeah, I agree. Worrying about school at home, right? So it's not just that she's at school and having these experiences, she's now asking her mom these questions, right? And seeking reassurance in other settings. So it's clearly interfering in multiple ways in multiple settings. Yeah, and Janet, that avoidance piece is whenever I see avoidance, the first question I ask is what's going on, right? Why is avoidance happening? And I think we definitely want to try and tease that apart. All right, so very quickly, I am going to transition us into Jamboard. And we're going to continue with this same case study, but we have a few questions that are less close-ended, right? So, and these sets of questions, we actually really want to get you kind of like free response generating. Okay, so yeah, Kelly just dropped the link to Jamboard in the chat box, and just as a reminder, most people should be able to get into Jamboard. If you are not able to, please drop your comments in the chat box and we will just move them into Jamboard. So same case study, and we have a few different questions that we want to ask. And what I'm going to try and do is I'm going to try and essentially take responses and group them so we can kind of see the main themes that people are seeing. and saying with regard to Sam. If you have not been in Jamboard before, the way that this works is I'm going to move to kind of the first question. And what you can do is you can use on the left, you'll see on the left-hand side, there's a panel, and you can take a sticky note and you can type in your response and it will save to that specific, save to the slide. And then I will be able to kind of move it as we get rolling. And so let's start with our, again, this is our first case. This is still Sam. And so we've talked about how many behaviors you notice, what some of those signs might be for Sam. And the question that we have now is, what other information would you want or need about Sam to feel more confident that she's experiencing anxiety, right? So what's going to help you tease things apart a little bit more? And Alicia, yep, you can, that cap is like, is not the best, but we're going to be moving what you say into the Jamboard. So feel free to drop it in the chat. All right. This is where my, get to test my executive function skills. So all right. So someone is saying whether there are home issues or changes that Sam is preoccupied with. Okay. So yes, absolutely. So you're wanting to know essentially what else is going on. Is there more anxiety across context that we should be aware of? How often? Frequency. Oh, I love that. Yes. Are the symptoms showing up in relationship to other aspects of life? I'm gonna categorize this over here. Is it happening in other areas? Oh, I love all of this. This is great. Is she putting her head down because she's tired? Yeah. So like, what is actually like, why are some of these behaviors showing up? Asking Sam her opinion, valid. We should definitely talk to Sam. What was the student doing before the behaviors? So I think maybe a little bit more at that context. Again, any home changes? Yeah, classroom atmosphere. All right, I'm gonna keep moving. Is there a history of anxiety? Let's see. What helps her feel better? So we're getting into some strategies here. All right, I'm gonna kind of, I'm doing my best to keep up with everyone here. All right. I'm running out of space, team, but I'm gonna kind of move some of these over here. Does she have a good relationship with her teacher? So again, kind of getting at, like what are some of the classroom dynamics and what's going on here? All right, let's move this over to being with Sam. What's the relationship with her teacher? What are her relationships like? All right. Okay. Trying to kind of move some of these so we can see them all at the same time. All right. Okay, so I love this. So we've got a few different main themes going on here. So the first is, what's going on at home, right? Is there a history of anxiety? Like, what does this look like across contexts? I'm gonna move this over here. There are a few people who are, it's hard not to talk about anxiety without jumping into strategies and what we should be doing to kind of support her. Let me move our bullying over here. Moving our family history over here. Amazing. Okay, I'm gonna move. So the person who has dropped screening suggestions, I think that is super important. And I'm so glad you brought it up. I'm moving it over into like what other sources of data collection can we get, right? So an interview with Sam and screening items feels like a really concrete next step. And it may be that you do the questionnaires with her and do a follow-up interview to kind of try and tease apart how she responded and why. Awesome. Okay. So again, has there been any changes at school? All right. What is the intensity of the behavior? I'm putting that over here. Okay. Oh my goodness. You all are amazing. And this really has um okay. Putting her in a how's she doing academically? Is she an ELL student? And just again, some of that more specific information on her behavior. So we there's a lot of things we can do to assess this, but I think what I see here is again information across contexts. We need information about our family. We need to know information about, are these things showing up in other settings? And then let's get specific about what the behavior actually is. So what's the frequency? How intense is it? What's happening before it? The person who noted antecedents, right? Like what are the common triggers, right? And then let's think about kind of actually talking to Sam and doing some screeners. And then, okay, let's zoom out. And I really kind of appreciate some of these bigger picture considerations, which is like, how is she doing academically, right? Is she right? Is she worried potentially because the academic demands are high and she's struggling, right? Which might be different than she is academically kind of on track and doing okay, but just anxious about making mistakes, right? And there's some of that perfectionism at play. Um, and then, I think all of this environmental piece is super important. And we're going to be alluding in our next case study, we're going to be talking a lot about the environment. So is there something about her relationship with her teacher, her class, her peers? Is she being bullied? What about her environment could be contributing to anxiety? So we're going to take this holistic picture, right? And use that, right, to help us understand, A, is anxiety present? And then B, what the heck do you do? Well, what you do is going to depend on some of these things, right? If she's feeling anxious because she's being bullied, right, or her relationship with her teacher is not great, how you're going to support her is going to be very different, right, than if those relationships are strong and in place. So, just wanted to kind of give that context. And then just one, I think this is let me just triple check. We're gonna do maybe 2 more questions related to this case study before we move on to our second case study. And for this question, we wanna know something specific. And someone who dropped a comment in for the last question alluded to this, but Sam is using spoken communication, right? And that at times can make it easier to identify anxiety because kid might tell us that they're feeling anxious. But what if Sam wasn't using spoken communication, right? So what sorts of behaviors might you be paying extra close attention to help you understand whether she's anxious? Yeah, behavior, yelling and hitting. Okay. Yeah, like we talked about. Oh, I love that. Facial expressions. Yeah, our faces can tell us a lot. Um, Fidgeting and stimming. I'm gonna move that slightly over here. Love this. Okay. Crying, body language, moaning. Yeah. Avoidance. Okay, I'm gonna kind of put that near our isolation from the class. Shutting down. Yep. Regression in skills, self-harm. Yeah, behavior becomes very important, very, very important. Eloping, I'm gonna put this kind of over here as well. Body language, posture, becoming more withdrawn. Yeah, okay. Pacing back and forth, absolutely. Okay, some of these are kind of, they're double dipping. So I'm just moving them kind of as I see. Yeah, I love that. This is the first time we've seen kind of this bathroom break. Okay. Sudden changes in behavior. Okay. Amazing. Yeah, so we're coming up with in these situations, right? We're thinking a lot about behavior. And this is where it becomes really tricky because we are again relying on behavior and thinking through like what are all the possible cues that people can give us, right? Um, Okay, I'm gonna just put our sleep stuff together. We may wanna, yep, we probably wanna check in with maybe parents about that. Although it may not make things, may not show up in school, right? Changes in sleep certainly would impact school, right? Maybe kids are less engaged, right? Or putting their head on their desk because they're super tired. Um, so I think that's really important. Leaving or checking out. I'm just putting all of our like uh, avoidance types of questions together here. Okay, refusal to eat. I'm gonna do this over here. It's kind of our biological changes. Okay, let me get those moved a little bit. Okay, and refusing to go to school. So again, these are kind of our big avoidance ones. So what I will say is that when we think about behavior, we really do want to be thinking about, not just, and we all alluded to this in the previous slide, what is the behavior? How often is it happening? What's leading up to the behavior? Is it persistent, right? And right, if kids are often avoiding something, it can be hard to know why that is, if it's just unpleasant, right? Or if it's hard or anxiety provoking. And so we want to be carefully kind of tracking some of these things. And some of the strategies that we're going to be talking about in a couple weeks are relevant, right? Kind of irrespective of the specific kind of behavior and anxiety that we're seeing. So, but we want to be paying extra careful attention to some of those visual cues. All right, and then finally, before we transition to our next case study, we're interested in knowing, right? It sounds like y'all suspect that Sam might be anxious, right? There's certainly some things that are flagging for you. What are your definite next? What's like the one thing that you're going to do to confirm and support the student? Yeah, assessment, parent and teacher interviews. Perfect. I think getting information from multiple different informants and people can be super helpful, right? Sometimes kids have trouble reporting on their own anxiety, so we do want to rely on parents. Sometimes parents don't see the anxiety, but their kids are like, I'm so anxious, right? And sometimes neither of those things are the case, but the teachers are really noticing something that's shown up. Yeah, I love that. Yeah, absolutely. I love this. Yep. And again, there are, in our previous slide, there was reference to a few different anxiety scales that can be used as assessment tools. I saw the GAD-7. There's also the SCARED, the Screen for Child Anxiety and Related Disorders, and that can be a useful tool as well. Okay. Yeah, so I love for the person who put in the referral to outside help as well as any other MTSS supports. I think it's important at this time, depending on your role, you may be the person doing the assessment, but you may not, right? And so you may at this point be making a referral or pulling other people in to help you. I love this. So, um, okay, so we're gonna kind of do some formal assessment. I love that. Maybe put some supports in place and see how Sam responds, right? I think that's reasonable to assume it might be anxiety and to start to support them. Oh, accommodations. This is great. Okay. Yeah, I love that folks are doing assessments that include parent and teacher input. Yeah. All right, talk with Sam. Yeah, again, more data collection. Fantastic. So again, we're going to just gather that information, make our determination, and maybe at the same time, right, already start to, get the school count and kind of get some things moving, right, and get some of those supports in place. Yeah, awesome. Well, we are going to transition. So this is Sam. We're going to do one more case study with some similar but slightly different questions. And I think that this will just, again, be our way of saying, okay, how the heck are we going to tease this apart and really figure this out? And so we're going to start with some polling questions, and then we just have two open-ended discussion questions for Jack. And so for Jack, he is a different kiddo. He's in 8th grade, so he's a little bit older. He's in a large public middle school. And so Jack received an autism diagnosis when he was in kindergarten, and he actually qualifies for an IEP under that autism designation. So slightly different than Sam. But he also participates in Gen Ed and does well, but he really struggles in group work, right? And to someone else's point earlier, is quick to correct others if they're not following the rules, and becomes upset when peers are off topic, right? When they're loud or when they're not contributing to the project, which honestly is kind of fair, but it might be interfering for him. And unfortunately, peers are starting to make fun of him and call him the rules police. When there's a hard group project, or when there is any group project, he's now saying, I don't want to do it, or he's trying to get to the nurse's office because he's complaining about a headache. And he has a hard time at lunch and recess where he says it's too loud and that he doesn't like to be watched by other kids. So he's protesting going to both activities and is asking to go to the library instead. So his school team's wondering if anxiety is at play, right? And what their next steps are to support him. And we have some questions that we're going to dive into in Jamboard, but are wondering first, similar to Sam, just what types of anxiety symptoms and cues you're seeing for Jack. Kelly, are you able to share that back? Thanks. Cool. All right. So lots of different, right? Lots of different potential cues. In some ways, similar to Sam, some things that feel more apparent and some things that we might want to dig a little bit on. But yeah, the nurse's office of the headache, right? Some of that avoidance is always a flag, right? Saying that he doesn't want to be watched, doesn't want to go to recess, right? We want to know what's going on there. Protesting, trying to get out of doing group work. I think all of those things are very valid, right? And this is something I think that we see a fair amount. And so there are some, I think, really important questions to be asking for Jack. um, we're going to talk a little bit first about, again, some of that additional information that you feel like you need for him. And then I want to preview only because that the next question is going to be about environmental kind of things that you want to know about. But for Jack himself, like what are some things that you might want to know about him to feel confident that he is experiencing anxiety at school? Yeah. Yeah. So same thing. We'll do onset, frequency, intensity of behaviors. Yeah. So like how, right, is he protesting going to recess every day or is this just like once a week? Yeah. These new symptoms, getting enough rest at home. Does he have peers he feels comfortable with? Yeah. Yeah. Everyone kind of knows, is this a regression or are these the same things? Yeah. That he's experienced before. Does he have close friends? Yeah. Does he have a support group? Like what's going on with peers at school? Okay. What are the triggers? I love this. Okay. Yeah, is it redirectable? Like how intense is this? Is this that like he's totally shut down or is it like shuts down and then he move like we can say like, okay, come on, Jack, and he's able to do it. So like is there interference? Yep. Again, is like, you know, is this something that's new? Like what's going on here? New or same behaviors? Yeah. Is it coming up across other settings? Yeah. What's going on with teachers in the class? And does he have a medical? Yeah, are there we kind of got into this like this a little bit, but I think anytime we see physical complaints, we have to be super careful, right? If kiddos really are, sick or have kind of chronic things going on, we definitely don't want to we definitely don't want to overlook this. Yeah. Okay. Yeah, getting at that frequency, and some of those strategies. Like what makes this more? Yeah. Yeah, so I'm trying to kind of group these. Let's see. What makes him feel comfortable? Is he able to be successful? Do other students feel the same way he does? Yeah. Is this maybe like a pervasive school issue that maybe it's not just Jack who's having a hard time? Yeah. Does he need some breaks? Yeah. Again, what's gonna make him feel comfortable? Yeah. Okay. Yeah. Any changes to sensory needs? Okay. And is this coming up in other settings? What can we do to support him? Okay. Okay. Same type of thing. So again, I love this. And I was trying to kind of group them in the same sequence and structure as we did in our previous case study, right? We want to understand, is there something else going on, right? Like, is there a sleep issue? Are there medical conditions? And then we want to think through, is this a new behavior or is this kind of a pervasive issue here? Um, and then thinking through, again, are there changes that contributed to this? What are some of the triggers and how intense is this behavior? I love that people jump into like what supports Jack might need and, what supports is he already getting? Are those things being implemented? So maybe, right, it's not that, he himself is so anxious, but maybe there are modifications and supports that he's not getting that's kind of exacerbating some of his anxiety and some of these behaviors. And then I think importantly, right, I love these references to the IEP. Um, what do his peer relationships look like? What does his relationship with his teacher look like? Is this a pervasive issue with other kids? Or is this like a very circumscribed situation? So I want to get lots of different information for Jack. Okay. But super important. I read that case study and I'm like, okay, certainly we have kind of our signs of anxiety that may be popping up, but there could be some other things going on that are really, I think we have to be super cautious, right? I think we jump to, okay, Jack's anxious, right? Like we need to support Jack in feeling less anxious. And all of that is true. But if there are environmental triggers and things about Jack's environment that are not supporting him, right? Or that actually might be exacerbating his, anxiety. We have to know about those things, right? And we have to be thinking about those things. I think it's important to remember that our autistic kids are more likely to be victimized and bullied, and to be in settings that are just not right. They're so overwhelming for them. So what about the student's environment? Do you think um, might be contributing to his anxiety? And I think it's okay here to think about what might that mean, right, for us? Yeah, totally. Yeah. The cafeteria is loud, maybe. I don't know. Recess is loud, or maybe um, mhm. Whoops. Yeah. I'm gonna put the peer stuff over here, sensory. So maybe, yeah, what's going on with these other students and why are they like so mean or maybe not, why are they kind of picking on him? Uh, yeah, and like maybe the rules aren't consistent and that's like super stressful, you know. Yeah, I'm gonna kind of put some of these bullying things over here. Okay, I'm gonna do classroom management. Yeah, classroom stuff here. Yeah. I think this is really important. And again, I feel the need to say these things because classroom management. Yeah, anything like going on at home that we should know about? Okay. A lot of things there. A lot of things fall into our kind of sensory and kind of a peer bucket. So we're in classroom management. But I love some of these things too. Like, does he have choice, right? Like, what are some of these other supports? Is this the best fit for him? I got a little, I noticed our page is a little imbalanced because I started to group things, close together on the right hand side, right? But again, I think we do want to be thinking about like, is he being bullied and teased? Are there issues with classroom management that actually, or inconsistency that are fueling some of these issues? Because those are things that are super important to address. We can't expect Jack to just miraculously tolerate, right, and be okay, and not feel anxious if kids aren't treating him super well. Um, yeah, I know. And I appreciate the comments about sensory differences and noise. I think we really need to be thinking about those things and thinking about what are some accommodations that would make these situations easier, right? Or are there environmental changes? Like, is going to the library for lunch a problem? I don't know. Like if sensory stuff is truly hard, you know, absolutely. I think those biological things are important to think about. All right. We just have one more question. So our kind of little question for Jack is the same for Sam. I want to know um, again, what are those next steps? We recognize that these case studies are just one kind of little snapshot of these kids. So what would you do to confirm? Mm. I love this. I love these. So you're gonna, right, immediately make some of these environmental changes. I think that's fair, right? And understand, right? Are these actually going to support him and kind of reduce some of that anxiety? Yeah, that. Yeah. Let's figure out what's going on in the classroom here. Consult with parents. Yeah, we've heard this before. We need some information. Is rule following hard at home, right? Are they seeing some of that rigidity pop up? Yeah, asking him what he needs. Meet with his team. Hmm, I love this idea. I'm gonna I'm actually gonna put this over here. It's kind of along the lines of asking him what he needs, but you're giving him a role, giving him a leadership role so that he does have a little bit more control. Yeah. Yeah. Love this. Yeah. Okay, these are so many good things. Okay. Okay. So I'm just grouping these here. But some things that are sticking out to me, and I'm gonna sort these other things as they're coming in that I think are really important. I love that we're already gonna talk about kind of how he can cope and handle this. Um, right? And we've talked about this, and we're going to talk a lot about it actually in 2 weeks, which is, when we're supporting kids who are anxious, right? There may also need to be skills that are taught alongside, right? We're going to teach Jack how to manage his anxiety, but we may, right, actually do need to help him figure out how do you navigate this situation and manage conflict, right? And what do you do? And so I appreciate the person who put that in and recognizing that we do need to teach skills as well. Okay. Classroom rules for partner work. Yeah, figuring out what we can do about the classroom, allow accommodations. Yeah. Okay. I'm given some, just move some things around here a little bit. So we're going to meet with this team, involve the school psychologist, set up an IEP meeting, and then we're going to start to kind of give some of those kind of accommodations and then start to teach some skills and give him some strategies. Fantastic. And we've got to talk to those other students and in the classroom and figure out what's going on. Again, it's not to say that Jack is potentially not anxious, right? But I think we want to understand in a holistic way, how do we support the mental health of all of our kids? Well, in order to do that, we need to understand holistically what might be contributing to some of the challenges that they're experiencing. Mhm. Yeah, amazing. Um, so again, here in a second, I'm gonna transition back into our slide deck. And I do wanna spend a little bit of time just doing a debrief and talking about some of those next steps and just to give you a preview of where we're headed for our next webinar. So I'm just gonna stop sharing this screen and we're gonna go into Zoom. Won't be anything different for you, just for me switching screens here. Okay. So I'm going to just breeze through these. These were the questions and the case studies that we just did. And I want to talk a little bit about our objectives for our next webinar, just to give you a preview of where we're heading. And I want to acknowledge Kelly's note in the chat box, which is that we're going to kind of run through a few more slides and open it up for questions. But if you do need to hop early, we just ask that you complete a survey to give us some feedback. But in 2 weeks, we're going to be talking about actual strategies. A lot of you began to allude to coping mechanisms and things that we can do to support Sam and Jack. In 2 weeks, we're going to be talking about evidence-based approaches to supporting anxiety in autistic students. And so what are those strategies? How could they look, right? And to talk a little bit about how different mental health programming can be delivered in schools. And I think just as you can imagine, that can look a lot of different ways. And so we want to be thinking about what that could be. And we'll be doing some case studies where we'll actually be talking about, okay, given this specific situation and given what we just talked about in terms of evidence-based strategies, what might you do to support a given student? So we're really looking forward to talking about that. And I want to just again reference the fact that in our mental health toolkit that we've put together over the past years, there's a couple of other webinars on anxiety, and there's actually a 2-page report on some anxiety best practices. And so you're welcome to check those out between now and the next webinar. We will be giving an overview of those strategies again and talking you through what they are, but feel free to check out some of those resources in the meantime. Just to wrap up, and then we'll, again, I'm going to open up for questions at the end, but some things that we're always interested in knowing is what other mental health topics do you want to know more about? We recognize that anxiety is just one thing. It is prevalent, but one thing. And for any topics that you do select, what are some of the formats that you're most likely to digest? And what would be preferred. So thanks so much for taking the time to fill this out. Awesome. Super helpful to see. Thank you. In case you're wondering what everyone said. Um, Obviously, I'm not necessarily surprised to see this at all, but thinking about kind of emotion regulation, executive function, trauma-informed care, neurodiversity affirming practices is super fun. I just want to, again, give that plug for the practitioner guide that we put in the chat box earlier that is more about language use. It's not necessarily about strategies per se, but I think it's a really important topic, and we can try and talk a little bit about it in 2 weeks. Awesome. Kelly, I'm going to toss it to you, and then we'll open it up for questions.
Thank you, Catherine. All right, so right here you can see a link to our evaluation, and Josie will also put that in the chat. I'll just reiterate it is very brief, won't take long, required by our funder. It does have two parts. At the end of the second part, you will be able to receive a certificate of attendance if that's something you need for today's session. And want to highlight again that SAMHSA has recently changed the survey, and so it is now easier to complete and give your feedback.
So these are just a few different resources that we want to end on. Obviously, the website for the Southeastern Mental Health Technology Transfer Center is on here. You're also welcome. My email is on this slide. You're welcome to reach out with specific questions about today's webinar or anxiety. And I see this question. I do want to open it up now and appreciate the little dialogue around it. I was going to say something very similar. There are lots of different support groups for autistic kids and parents of autistic kids. And it kind of depends where you live. You know, there are a few, so I would say, you know, to kind of, depending on where you live, some good places to start. A lot of states have hubs in their state that are specific to autism and other kind of intellectual and developmental disabilities. So like in Georgia State University hosts that as kind of that hub, right? And so I would be looking around, and a lot of university affiliated autism programs can kind of provide some of those supports, and might be able to see them there. Are there other questions? Please feel free to drop them in the chat or ask them in kind of the remaining 10 minutes that we've got together. You're welcome to come off mute too, whatever is easiest. Amazing. Okay, so Alexa says recommendations for supporting an enclosed SPED classroom as a school-based therapist. We have very low staff, underqualified staff, and a large size class for a small space. Yes, so I think it depends what type of support, you know, you're looking to provide. I will say that are you, Alexis, would you be able to say a little bit more? Are you looking to provide mental health support to these kiddos, or more just kind of like classroom management types of support?
I would say a little bit of both. They just really, I mean, walking by, you can hear the kids screaming, yelling. They're just very dysregulated. I've tried reading stories that usually help sometimes, but just as far as how to help with the classroom management, any suggestions maybe to give
Yeah.
to the teacher?
Yeah, so I will say this is such a good question. So there are a couple of things that come to mind. One is that it's not going to address all of your questions and concerns. This was about maybe 2 years ago now, so it was a little bit, and we did a webinar on strategies to support positive behavior in classrooms, and that included things like how to effectively, right, use visual supports, right, for example, to help with classroom management, right, how to use kind of different types of reinforcement systems to support classroom management. And so I think that could be a really good place to start. It is on our SEMHTTC website. It includes, and these are like, right, this isn't even specific, it sounds like, to mental health, right? This is just like, how do you support this kind of chaotic setting and get kids into a routine? And so I would recommend checking that out, because I think there are some foundational things around visual supports and classroom routines it sounds like it's a tricky situation, but that may help with some of that. Yeah, exactly. And thinking through, like, what are the sensory supports that are available to kids in that class, right? Is there something that environmentally can be done to structure the class in a way that's not so chaotic and overwhelming? yeah, want to kind of think that through now. But as you know, right, the use of visual schedules is only as good as you use them, right, and incorporate them. But it's a great place to kind of start to think structurally, you know. Yeah, I think that's a great question, Cambria. So information on how behavioral systems like token systems can actually create anxiety for children and alternate ways to address that behavior. So I can imagine, right, that there are kids who get really fixated on them, right, and are stressed, right? Like, what the heck happens when I don't? Does this mean that I'm bad? That I don't earn this token, right? And um, so I think there are a couple of things I'd be thinking about. Does the token system need to exist, right? You know, and what's the purpose of it? There certainly are alternative ways, right, to provide reinforcement and to make kids feel good that aren't tied to like specific tangible reward. So that could be one option. Another option is to actually work with the student, right? Like what and help the student kind of develop some kind of helpful thoughts around, you know, if I don't get the token, it's okay. It doesn't mean I'm bad, right? And we all don't get, like, none of us, right, earn a sticker every single day. And so I'd be thinking about, is the token system necessary? Are there other ways to implement it, right, that aren't, that aren't so kind of tough for the kiddo, and how can we support the kid in navigating? We see that a lot in kids, right? Or kids who have a hard time losing, right, or making mistakes. Those things are inevitably going to happen, and we need to kind of help kids cope with some of them. So I'm gonna check for questions. I see some questions about the certificate. Let's see.
Yeah, thanks for letting me know about the certificate. I can send the correct certificate to all the participants here. So just look for that to come through your email instead.
Awesome. Yeah, thanks for doing that. And thank you so much for doing this survey. I think it's, again, like Kelly mentioned, this is a really helpful way for us to get feedback on the content of the webinars that we're doing. And we're excited to post part 2 and to think about, again, what does this mean from a strategy standpoint? Looking for other questions, but yeah, thank you everyone. We really appreciate you tuning in. And again, I just want to say that if there are specific questions or things that come up, you're welcome again to reach out and email. We're happy to kind of support and make sure that you have the resources you need, either from our existing toolkits or other things too. I really, yeah, I agree. I'm just reading some of the other comments. But we're happy to kind of add additional, send you additional information that you might need. Yes, email's in the slideshow, and let me just drop it in the chat too. So you can I know you can't actually copy and paste things from the slide deck. So it is there as well. And I'll say that some of the work that we do here is definitely focused on kind of mental health, access to mental health services in schools, specifically for anxiety and for depression. And so we're more myself and I have a teammate here are again welcome and welcome any questions that you might have.
Stop recording, but I will be here until 1:30 if anyone needs anything or has any further questions.